video, we will learn about the diseases affecting the vasopressin system. Vasopressin is synthesized in the hypothalamus and secreted into the circulation by the neurons of the posterior pituitary. So what are the actions of vasopressin? Vasopressin has predominant action on the kidney and acting through the V2 receptors that are expressed in the collecting duct. It increases the permeability of the collecting ducts to water, thus producing an anti-diuretic effect, which means that it causes reabsorption of water, causing concentration of urine, increasing the urine osmolality and producing an anti-diuretic action, which is opposite to the diuretic effect. So what is diabetes insipidus? Diabetes insipidus is a condition characterized by inadequate secretion of vasopressin from the posterior pituitary or loss of responsiveness or inadequate responsiveness of the collecting ducts of the kidney to vasopressin. So inadequate response or decreased secretion of vasopressin leads to loss of anti-diuretic action, and this causes a disease known as diabetes insipidus, which is characterized by excretion of large volume of urine, that is more than 30 ml per day, and the urine is dilute, that is the osmolality is less than 200 milliosmolar per kilogram. So diabetes insipidus is characterized by the excretion of large volume of urine, dilute urine, and this is due to decreased secretion of vasopressin from the posterior pituitary or loss of responsiveness to vasopressin. Diabetes insipidus is of two types: central diabetes insipidus and nephrogenic diabetes insipidus. In central diabetes insipidus, the defect lies in the level of hypothalamus or posterior pituitary, which causes decreased secretion of vasopressin. So it is caused by a trauma or surgery to the hypothalamus or posterior pituitary, or tumors in the region of the hypothalamus and posterior pituitary, infections, infiltrations, cerebral ischemia, cerebral aneurysm are some of the causes of central diabetes insipidus, where the defect lies in the posterior pituitary and the hypothalamus, and this results in inadequate vasopressin secretion and inadequate anti-diuretic response. It can also be familial, which means that it is autosomal dominant, where there is mutation in the prohormone gene that encodes vasopressin. So mutation in the gene that produces vasopressin is defective, and that causes central diabetes insipidus. So what is nephrogenic diabetes insipidus? Nephrogenic diabetes insipidus is characterized by a mutation in the V2 receptors that are located in the collecting ducts of the kidney. So because of the mutation in the gene, there is loss of responsiveness to vasopressin that is present in the circulation, and this leads to inadequate anti-diuretic response. So mutation in the gene that is responsible for vasopressin secretion causes inactivation of aquaporin 2, and this leads to loss of responsiveness to vasopressin that is present in the circulation, and inadequate vasopressin response and decreased anti-diuretic effect, resulting in excretion of large volume of dilute urine with decreased osmolality and excretion of large volume of urine. So nephrogenic diabetes insipidus can also be due to acquired causes such as acquired hypercalcemia, hypokalemia, post-obstructive renal failure, and certain drugs such as lithium demiclocycline, clozapine can induce nephrogenic diabetes insipidus. So nephrogenic diabetes insipidus can be due to X-linked disorder due to mutation in the gene encoding the V2 receptors that are expressed in the kidney, and it can also be due to acquired causes. Coming to the treatment of central diabetes insipidus. Central diabetes insipidus is characterized by decreased vasopressin secretion by the posterior pituitary. So there is inadequate or low levels of vasopressin in the circulation. So in such a condition, administration of desmopressin, an anti-diuretic peptide, acts on the V2 receptors of the kidney and produces an anti-diuretic response, and this leads to conservation of water and concentration of urine, and is very useful in the treatment of diabetes insipidus, which is characterized by the excretion of large volume of dilute urine. So desmopressin, by acting on the V2 receptors of the kidney, produces an anti-diuretic response. In situations where the anti-diuretic peptides cannot be administered or are contraindicated, for example, if there are side effects or allergic reactions, then there are certain drugs that potentiate the vasopressin action and produce an anti-diuretic response. So these drugs are clopropamide, carbamazepine and clofibrin. So clopropamide is a sulfonylurea drug and it can potentiate the anti-diuretic response of vasopressin and helps in the treatment of central diabetes insipidus. But to be noted that these drugs, that is both desmopressin and the other drugs such as clopropamide, carbamazepine, clofibrin, are not effective in nephrogenic diabetes insipidus. This is because in nephrogenic diabetes insipidus there are non-functional V2 receptors. So V2 receptors are non-functional and fails to produce therapeutic response. So desmopressin is the preferred drug. It is the mainstay therapy in the management of central diabetes insipidus, but not in nephrogenic diabetes insipidus. So now moving on to the treatment of nephrogenic diabetes insipidus, which is also characterized by excretion of large volume of dilute urine, and this is due to inadequate response to vasopressin. Because in nephrogenic diabetes insipidus, there is a mutation in the gene encoding the V2 receptors expressed in the collecting duct of the kidney, there is loss of responsiveness to vasopressin action. So failure of anti-diuretic effect, which causes excretion of large volume of urine. Therefore, in nephrogenic diabetes insipidus, desmopressin is ineffective because the V2 receptors are non-functional. So how do we treat nephrogenic diabetes insipidus? First of all, the patient is advised to consume adequate water because there is excretion of large volume of water from the body, and this leads to increase in the plasma osmolality. So the patient is advised to consume adequate water. So adequate water intake should be advised, should be considered. Secondly, thiazide diuretics are the mainstay treatment in the management of nephrogenic diabetes insipidus. So how do the thiazide diuretics act? Thiazide diuretics act on the distal convoluted tubule by inhibiting the sodium chloride co-transporter, thus causing loss of sodium ions, or there is initial natriuresis or loss of sodium ions in urine. So because of the loss of sodium ions in urine, there is decreased extracellular fluid volume and reduced glomerular filtration rate. These changes causes excessive reabsorption of water from the proximal convoluted tubule, thus causing a decrease in the urine volume, urine flow, and is useful in the treatment of diabetes insipidus. Thus, thiazide diuretics decrease the urine volume and the urine flow in diabetes insipidus, and this is due to increased reabsorption of water from the proximal convoluted tubule. Next, as we have learned that there are certain drugs such as lithium, phoscarbonate, clozapine that can induce nephrogenic diabetes insipidus. So for treating lithium-induced nephrogenic diabetes insipidus, amiloride can be used. Amiloride blocks the lithium uptake by the sodium channels in the collecting ducts of the kidney and is helpful in the treatment of lithium-induced nephrogenic diabetes insipidus. So it can be combined with thiazide diuretics to produce better efficacy in the management of nephrogenic diabetes insipidus. So to sum up, the treatment of diabetes insipidus, which is of two types, central diabetes insipidus and nephrogenic diabetes insipidus. In central diabetes insipidus, desmopressin is the drug of choice, which is not effective in nephrogenic diabetes insipidus because of non-functional V2 receptors. So in nephrogenic diabetes insipidus, thiazide diuretics can be used, and amiloride is particularly useful in lithium-induced nephrogenic diabetes insipidus, and both anti-diuretics and amiloride can be combined to produce better effect or superior efficacy. The next disease of the vasopressin system is syndrome of inappropriate secretion of anti-diuretic hormone or SIADH. So SIDH is due to excessive secretion and excessive action of anti-diuretic hormone. The causes of SIDH include trauma, surgery, infections, infiltrations, tumors, and certain drugs such as psychotropic drugs, SSRI, tricyclic antidepressants, and vinca alkaloids, that is vincristine, vinblastin, can cause SIDH or syndrome of inappropriate secretion of vasopressin. In SIDH, there is high concentration of vasopressin levels or anti-diuretic hormone, and this causes excessive action of vasopressin. So as we have learned that vasopressin has predominant action on the kidney, and by acting through the V2 receptors causes concentration or renal conservation of water or concentration of urine and increase the urine osmolality. So excessive vasopressin action causes excessive concentration of urine leading to increased osmolality of urine. Because there is excessive reabsorption of water into the interstitium, there is expansion of extracellular fluid volume, and this decreases the plasma osmolality or hypotony of plasma occurs. Because of expansion of extracellular fluid volume, there is dilutional hyponatremia or the sodium level decreases below 120 millimolar per kilogram. So what are the clinical manifestations of the disease? Now, because there is dilutional hyponatremia, the patient presents with symptoms of anorexia, nausea, vomiting, muscle cramps, convulsions, coma. Death can also occur because of excessive influx of water into the brain cells causing CNS manifestations. So CNS manifestations are very common with syndrome of inappropriate secretion of vasopressin. So what is the treatment of SIDH? The goal in the management of SIDH is to increase the plasma osmolality and decrease the concentration of urine. So the plasma osmolality can be increased by restricting water intake and also administering hypertonic saline. So administration of hypertonic saline raises the plasma osmolality and reduces the symptoms of hyponatremia. Secondly, there are drugs such as loop diuretics which interfere with the concentrating ability of the kidney. And in SIDH, there is excessive concentration of urine. So loop diuretics, by inhibiting the concentrating ability of the kidney, is helpful in the management of SIDH. Also, there are drugs such as demiclocycline and lithium that inhibit anti-diuretic action, or they inhibit the actions of vasopressin. So by inhibiting the actions of vasopressin, they are helpful in the management of SIDH. Although lithium is useful in the management of this disease, it cannot be used chronically or for a long term because it can cause irreversible kidney damage and it has a low therapeutic index. Therefore, lithium should not be recommended for long-term use. However, demiclocycline can be administered in patients with SIDH because they inhibit the actions of vasopressin and decrease the anti-diuretic response of vasopressin. So to sum up, SIDH is characterized by excessive vasopressin secretion which causes renal conservation of water, concentration of urine, and this causes expansion of extracellular fluid volume, dilutional hyponatremia, decrease in plasma osmolality. So here the therapeutic goal is to increase the plasma osmolality and treat dilutional hyponatremia which can cause CNS manifestations. So the treatment options include administration of hypertonic saline and restriction of fluid intake. So fluid intake should be restricted and the hypertonic saline can raise the plasma osmolality and treat dilutional hyponatremia. Then there are drugs such as demiclocycline, lithium that inhibits the vasopressin action, and also there are drugs such as tolvaptan and conivaptan that are V2 receptor antagonists. So V2 receptor antagonists such as conivaptan and tolvaptan antagonize V2 receptors and treats or prevents excessive vasopressin action. Lastly, the loop diuretics, by interfering with the concentrating ability of the kidney, is helpful in the management of SIDH, where there is excessive vasopressin secretion and there is increased concentration of urine. So loop diuretics inhibit the concentration of urine and treats SIDH.
This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.